Hello, welcome to today's video where I'm going to give you some quick tips on treating your back pain. If you're suffering from back pain at the moment, it's terribly frustrating because you won't be able to get to see a therapist and get some hands-on treatment. So you're going to have to pretty much self-treat this issue yourselves. This is a good movement flow to do, just starting in all fours and moving from spinal extension to spinal flexion. It can help to free up your lumbar spine and to reduce that sensitivity and generally help you move a little bit freer and easier. From this flexed position, it's then a nice progression to drop your bum down onto your heels and to go into this stretch position here, commonly called the child's pose. From this position you can relax and stretch into it further, and then try moving your hands across over to one side so that you bias that stretch to one side of your lumbar spine, and then bringing your arms over the other way and biasing the stretch to the opposite side as well. So that's a good movement flow that you can do. You can also do that from the supine position, lying down on your back, bringing one knee up at a time just to encourage some flexion through your lumbar spine, and then of course bringing both knees up together to encourage some lumbar flexion, which can just reduce that sensitivity and make day-to-day tasks like bending forwards to pick things up from the floor that much more comfortable. To get the most benefit from doing exercises like that, take your time and don't rush them or force them. Right, how about taping your lower back? Well, it's very effective to tape your lumbar spine for lower back pain, but it of course is a little bit tricky to do yourself. However, let me have a go at showing you how you can give it a try. So, assuming you haven't got any wide tape, I'm going to use 2 strips of normal 5cm rock tape here, which I've cut and measured to go across my lumbar spine. So the best way to apply this tape yourself is to go into a flexed kneeling position like so, to encourage as much flexion through the lumbar spine as possible. Pare away the backing paper from the centre and then have the backing paper remaining on the outsides of the tape so that you can stretch it and stick it to your spine. With the tape behind you, over your lower back, stretch the tape by about 50% and apply it as evenly as you can over your lumbar spine, with the last pieces going down without any stretch. Then make sure the tape is securely rubbed down over the lumbar spine, and then once again feel where the existing tape is and then aim to place the next piece of tape just above that existing tape with roughly that 50% stretch, and then no stretch on the ends, making sure you don't forget to rub the tape down securely, guys, so it sticks onto the skin. And there we go. That's how you can tape your own lumbar spine. It would be possible to add another strip of tape on there if you wanted to, but after you've got 2 or 3 strips, that's usually enough to offer some relief from back pain. So it may not look as pretty or aesthetic as when your therapist does it for you, but it can still be very effective for reducing your back pain. And I often do this technique myself when my back is aching from standing too much, particularly when I'm teaching. Alright, well, I hope that helps. Have a good day. I'll see you in the next video.